Hello, my name is Karen Paklibar. I'm gonna do respiratory exam for today, and this is my 360 view. Okay. So today we're gonna do general check, general appearance check, inspect, palpate, percuss, and auscultate your respiratory system. Okay. So to begin with, I wanted to breathe normally. As I can see from here, normal breathing. She's calm and relaxed. Even when she's talking quite a bit, she doesn't have any signs of acute respiratory distress. Normal expansion of the lungs while she's breathing, and rate and depth are within like 12 to 20, which is normal for breathing, beats per minute, breathing per minute. The expansion is good, symmetrical breathing, and I don't see any usage of sternocleidomastoid muscles as well, and accessory muscles. So I'm gonna also check her skin color, which is just appropriate for her race. I don't see any paleness or pallor, and also cyanosis. Her lips are as well pinkish, no signs of cyanosis. Her nail beds are also with good capillary fill, no signs of cyanosis. General skin overall is appropriate for her. I can see from her trachea, there's no deviation. If you can turn on that side, friends. There's no deviation while she's breathing. Trachea is the midline, okay? I'm gonna do some inspection. Anteriorly and posteriorly, lung expansion or chest rise is within normal, symmetrical, bilateral as well. No lag and retractions. Now we're gonna do is, and then there's also no chest wall deformity as well. So for palpation, I will palpate anterior. Well, I'm gonna start first anteriorly from like inspection, palpation, percussion, and auscultation, and then I'll move to posterior. So palpation, I will palpate. Just breathe normally for me. Tell me if there's any tenderness, okay? Any pain?
No.
You can cross your arms if that one, so I can see. I can also palpate laterally. If there's any pain, you let me know, okay?
Okay.
And then now, friends, I want you to say or speak 99 to check for tactile fremitus, okay?
99, 99, 99, 99, 99, 99.
Lateral.
99.
So,
99.
resonant tone heard over lung fields. Now I want to do some percussion as well, okay?
Okay.
And I'm gonna do it on the other side, right lateral. Let me first go for this one first. Tell me if there's any discomfort, friends, okay?
Okay.
And then left lateral. So resonant tone heard over anterior lung fields and also lateral. I'm gonna move now to auscultation. So I want you to breathe within, like opening your mouth while you're breathing through your mouth. Okay, do one more. Yeah. Try to open your mouth and then breathe in your mouth like. Okay. There you go. Good. So now I'm gonna auscultate your breath sounds. Okay, let's start from here. Breathe. Breathe. Okay. Okay, lateral. Breathe. 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 Okay. And then the other lateral. Breathe. Okay. Anteriorly and then lateral is also clear breath sounds. I don't see any crepitus. I don't see any stridors. I also want to do, I'm going to also auscultate while you're saying 99, okay?
Okay.
So you say 99 every time I move my stethoscope, okay? Right, start.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, anteriorly, when I auscultate bronchophony, on the upper side of the chest or her lungs are more clear, and as I go down, it becomes duller on this side, the lower part, and also on the lateral side, which is the last anterior as well. I'm gonna do also auscultate while you're saying letter E, okay?
Okay.
All right, friends.
E, 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 E.
Okay, very well. So like I said, also with 99 E, she was able to pronounce it very well with E, not A or A. Next is I want you to whisper 1, 2, 3 as I move, and I'll do auscultate, and as I move also my stethoscope. Okay,
Okay. 1, 2,
whisper.
1, 2,
Lateral.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1
So with Erkapani, or whispered one, whispered pectoralocoki, I was able to hear slightly from the upper part, the anterior side, but once I go down, it becomes dull, and also lateral on the upper side, upper part of the chest or the lungs, I can hear still the whisper, but as I go down laterally, it also to the base of the lungs, I was hearing it like dull. Okay, now first I want you to turn on your side so we can do the posterior side. I've done the anterior and I've done the lateral as well. So now what I'm gonna do is the posterior, and I'm gonna start again all over from like general appearance. I don't see any deformities. Equally bilateral. I don't see any acute distress. She's calm, she's relaxed, and then as well as like rate rhythm. The rate is between 12 to 20, which is a normal range. Her rhythm is also even and moderate, and as well as the depth is also within normal as well. So there's no use of accessory muscles while she's breathing, even that there's no shoulder rise. There's no shrugging of her shoulders as well. Color appropriate for her skin. There's no pallor, there's no cyanosis. I don't see as well any pallor, and there's no wheezing and stridor or as I can feel. And also her trachea, as again posteriorly, is also in midline and no deviation. So now I'm gonna start with the chest inspection. So note barrel chest, diameter for like AP to lateral is doing good. Okay, so asymmetric, can you take a deep breath for me, friends? Okay, and slowly exhale. Okay, one more. Okay, now I'm gonna pull this shirt up, so I just want to show this one as you extend. When you're like trying to expose or I wanted to expose as like the expansion of your chest posteriorly. Okay.
Okay.
I'm gonna move the camera. Okay. So friends, try to breathe with your like using your mouth open. Okay. Ready?
Okay.
Go. Okay, one more. Okay, so as I can see from here, once she was inhaling, I can also see that my two thumbs and my hand were like also adjusting to how she is breathing. Okay, so now let's gonna start. So that's her expansion, symmetrical expansion bilaterally, and then there's also smooth movement with my thumb as she inhale and exhale. For tactile parameters, I want to also test this one, okay?
Okay.
Can you say 99 for me?
99, 99, 99, 99, 99, 99.
Okay. She was able to say without, I can say that it's equally bilateral on both sides of the chest, posteriorly speaking. Now we're gonna do percussion, okay?
Okay.
So resonant has been heard all over her lungs, posteriorly, both sides of the lungs. I'm gonna do for percussion. I'm gonna do auscultation. Breathe with your arms, with your mouth open, as I move my stethoscope. Okay.
Okay.
Okay. You're doing great. So auscultation wise, breathing sounds are clear. I don't hear any crepitus. I don't hear any like I don't hear any anything like wheezes as well. So now what we're gonna do, I already tested the lateral as well earlier. So right now I'm just gonna do the auscultation posteriorly. Let's do the bronchophony on a posterior side. So I wanted to speak 99 as I move my stethoscope, okay?
Okay.
Or my diaphragm, the stethoscope, okay? Ready?
99,
Okay, go.
99, 99, 99, 99, 99, 99, 99, 99.
And then I wanted to say letter E.
E, 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 E.
And then last is whisper. 1,
One.
2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1.
Okay, so now that concludes our respiratory exam.